Morning, everyone, and thank you for joining us for today's campus update briefing, our first one of the fall semester, live from our beautiful campus here at the University of Arizona. I'm Holly Jensen, Vice President of Communications. Today, Dr. Robert Robbins, President of the University of Arizona, is going to provide important information on the university's plan for welcoming our students back in person this fall. President Robbins is joined by Dr. Richard Carmona, 17th Surgeon General of the United States and Distinguished Professor at the University of Arizona. He's going to provide updates on the current state of the Delta variant and our public health conditions. With that, I will turn it over to you, President Robbins.
Thank you, Holly, and good morning. Thank you all for joining us. The University of Arizona's fall 2021 semester will begin for most students 2 weeks from today. The university will begin the semester with all campus-based courses delivered in person. As we prepare for the start of classes, we recognize the challenges presented to all of us by the Delta variant, which is more contagious than the lineages of SARS-CoV-2 that we dealt with last academic year, and which is now the dominant strain in the United States. This is a very critical moment. I know many of us relaxed over the summer, and we had begun to think that the pandemic was well behind us. The good news is that this is what we know. We have highly effective, safe vaccines that are truly a miracle of medical science. We know that face coverings are efficient in preventing transmission. We know that for indoor spaces, ventilation upgrades can make a significant difference in the amount of airborne viral particles. And we know that the availability of quick, reliable testing can help track and contain the virus. Layering these approaches is critical. And with this in mind, we have several strategies in place for the safety of the university. I mentioned the vaccines a moment ago, and I will return to that topic later. Secondly, and I know many of you are interested in this, we are strongly encouraging masks in our indoor spaces, and particularly in our classrooms and laboratories. I want to be clear that I expect everyone to cover their face when they're indoors. It is my expectation that we will all respect each other and wear masks in these areas to promote in-person learning and the most effective health and safety protocols. Of course, there are spaces on campuses where masks will be absolutely required, such as in healthcare facilities, labs, and other areas as allowed by state law. As I said before, we know masks work, and I encourage them in the strongest possible terms. Supplies of masks will be available in every classroom, as will cleaning supplies. We've also prepared classrooms and other congregate spaces to minimize the risk of transmission. Of particular note, the university's facilities management team has installed 8,000 MERV 13 filters in classrooms and other office spaces throughout our campus. Improved ventilation is part of the layered approach recommended by the CDC, and these filters are very efficient at removing airborne particles of the size that usually transport the SARS-CoV-2 virus. In addition, we will continue to offer COVID-19 tests to the campus community. Tests are available in the Catalina room of the Stanford Union. In the Student Union, this site will transition to rapid antigen tests on August 16th. This location is for asymptomatic individuals and an appointment is required. Visit covid19.arizona.edu for details. Symptomatic individuals can make an appointment with Campus Health for a test. If you're vaccinated, please note that symptoms for breakthrough infections are more similar to the common cold, whereas in unvaccinated individuals, the symptoms tend to be more like cases of influenza. Students who test positive but will be required to isolate. Rooms will be provided in separate dorms as we did last year, or students may isolate off campus. To close, I want to come back to the vaccines for a moment. They do two things for you as an individual. First, they lower the risk of contracting this virus. Secondly, and this part is not as well understood, but they dramatically lower the risk of severe disease or death if you contract the virus. This remains true even with the Delta variant. The vast majority of those who require hospitalization and are at risk of dying are those who are unvaccinated. Vaccination also decreases the risk of infecting others, even following a breakthrough infection. It does not reduce the risk to zero, but it does significantly reduce it. We need to think of masking, vaccines, and other measures as complementary parts of the solution, not separate approaches. Layering our strategies to minimize the risk to ourselves and others works best. It is very disheartening to see vaccination and face coverings as topics of controversy. While they are indeed choices we make as individuals, I want all of us to remember that these are not choices we are making only for ourselves. In a public health context, our choices affect others. In a recent newsletter to his students, faculty, and staff, Dr. Michael Abacasis, the Dean of our College of Medicine in Tucson, shared a quote from Dr. Than Neville, an ICU physician. And Dr. Neville said, an individual's decision not to get vaccinated is a decision not to protect themselves or their loved ones. And he continued, it is a decision to fill a precious ICU bed, to let new variants flourish, and to endanger the healthcare workers and immunosuppressed people around them. I would also add, it also increases the risk to others who are unable to be vaccinated, which currently includes young children. Please wear a mask in public, especially indoors. That's what my expectation for our campus community will be. If you're not yet vaccinated, please consider making an appointment today. If you are a university employee or student, you can receive the Pfizer vaccine at Campus Health. We cannot move on from this pandemic, but the only path is through the challenge in front of us. We cannot go around it, and we cannot hide from it.
Thanks, President Robbins. I'll turn it over to you, Dr. Carmona. You're muted.
Okay. Thanks, Holly. I think I was just unmuted by central control. Thank you. It's good to be back. Although I might want to let our listeners and viewers know we really never left because since we went on the hiatus for the summer, the incident command team has continued to work on a daily basis, provide the president with briefings every 24 hours on situational awareness locally in Pima County and the city, statewide, nationally, and even globally, so that we were always tracking how things were looking. And interestingly, up until about a month ago, we were all feeling pretty good until this variant arose, the Delta variant, which came from India and took a few months to get here, but now it's the predominant variant that we see in the United States. And what is really interesting, we had already started receiving plans and everybody was excited about our university opening again and going back to that new normal. And yet, because we were able to keep tracking this, although it appeared we weren't there, the president will tell you we were bugging him every day and usually several times a day with data so that he could always make the best decisions. And over the last couple of weeks, we realized that this variant was taking such a strong hold that it was going to be disruptive in our environment. And hence, we started to have more meetings about planning to see what we might have to do, what resources, supply chain, testing, treating, all of those things that we're going to be speaking about. So I just wanted to reassure the community that the president has kept the incident command system and the senior staff stood up every single day dealing with this. Even though it looked like things were getting a lot better, we recognized that we're not always able to predict exactly what is going to occur. So since that time, with many conversations, we're here today being challenged by this variant. And I think I'll stop my remarks right now and then pass to Bobby. But I think one of the most important things we've learned is that we have the tools to be able to stop the transmissibility of this virus if we all act together cooperatively. We know that masking is effective. We know that hand washing is effective. When necessary, social distancing adds to that armamentarium, and vaccinations are the best thing that we can do. Every single one of us should get vaccinated. To do that helps to stop the spread of the infection. And as we've discussed many times, the vaccine not only helps you, it protects your community, it protects your family, because the more that this virus continues to spread, it will continue to mutate. And you've all heard about it on the news, you've read the stories. The fear is that eventually it can mutate to a virus that is a challenge to our vaccine, and maybe we have to go start all over again. Remember, this virus is the SARS and MERS virus from a few years ago. That's mutated. Now this mutation is creating a new disease constellation for us. So I think I speak for our whole team at the university, especially President Robbins, to urge everybody, please get your vaccination. There's ample sites all over town for you to be vaccinated, and it will help us a great deal. And Bobby, as we move into this new year, I think that the team you put together here at the university has a lot to be proud of, because nobody took a break, even though others were able to take a little vacation and move away from the COVID exhaustion that we were all feeling over the last year and a half. Your team has stayed functioning and briefing you every day in spite of the fact that things look good. And because of that, we're able now to surge concomitantly with the threat before us to be able to assemble the best information to help you make the best decisions to keep our university open safely. So thank you for your leadership, but thanks to the team who's tirelessly continued to work since we went on that so-called summer hiatus.
Okay, Holly, I think there are a lot of people who have questions. Maybe we should go straight to the questions.
Sure. Our first question comes from Bud Foster from KOLD. Go ahead, Bud.
All right. Can you hear me?
Yes.
But
Okay. Both of you guys are medical doctors. Strongly recommend is far from a requirement. You've got students coming in from all over the world, 32,000 of them, many of them staying on campus. What do you think of this? What do you think of this idea that you can strongly recommend, but you can't require?
Yeah, I think, Bud, that it's a good point. The ideal would be that we could require everyone to be vaccinated. We could require everyone to cover their face. We could require many things that other places are doing, but we cannot do here because of state law. And obviously, we're going to obey the law. But we're going to also encourage, and where we can, require the things that we can require, such as masks. We're obviously working in collaboration with the governor and our board of regents and the other two universities to come up with a strategy that allows us to keep our campuses open and keep them as safe as we possibly can. The vaccine is really the key. I don't even know how many people are vaccinated at the university. We have some strong ideas that it's probably more than 50%. I just don't know. But with this Delta variant, I think we're probably needing to be in the 85+% to get that quote herd immunity. So the real push, the real key is going to be to get as many people as possible vaccinated.
Yep. All right. Our next question comes from KGun9. Go ahead.
Hi, it's Greg Smith from KGun. giving the medical perspective of both of you, and how strongly you push for a lot of the very measures that you're prohibited from enforcing right now. When that law was in progress, when the governor was formulating his policies, did you all attempt to persuade them not to do that and allow you to use some of the methods in a mandatory way that you used last year?
Yeah, Craig, there's always conversations that are going on continuously, as Dr. Carmona has said. We've not stopped since sort of March 11th, 2020, every day, having conversations. I think I've been fairly clear about this is actually pretty straightforward. I think Rich could speak to this even more authoritatively than I can. I believe that the best public health practice is to require vaccination. I know that there are certain medical circumstances and certain philosophical or religious objections to vaccinations, but for the best public health policy, it would be at a university like ours, and for any mass gathering, to just require people to be vaccinated and to cover their face and to stay separate as much as possible and wash their hands. All the things that we said every one of these conferences last year, and will continue to say, because those are all good public health practices.
Can you say who you spoke to? I mean, did you talk to the governor, governor's aides, members of the legislature?
We talked to everybody, Craig. As you can imagine, we've been in constant dialogue with everyone, and certainly with leaders across the world about how to deal with this. I'll come back to the simple, straightforward answer is get as many people vaccinated as possible.
So, President Robbins, we have a couple of questions submitted from Catherine Palmer from the Arizona Daily Star. So I'm going to read them in succession, and I'll let you answer them one by one. And I think this goes off of what Craig just said a minute ago. How has the governor's ban on requiring masks and vaccines changed your plans for the semester? And what precautions will the school be able to take?
Well, it's changed things because it's removed some of the tools that would be effective at mitigating and fighting this virus. So we've got to work within the framework of the laws. And what we're proposing here today is that we believe we can continue to offer learning and teaching opportunities for our students. At the same time, strongly recommending vaccines, strongly recommending covering your face in all indoor venues. And I would just say cover your face when you're around anyone, no matter what. Because the idea, of course, was that we get our vaccine, now we're good to go. The problem is that is not the case. The Delta variant has shown us that even if you're vaccinated, you still need to follow these public health measures because you can still get the infection. No vaccine is 100% effective. These are very, very good. And as I said in my opening comments, it's truly one of the highlights in my lifetime of getting this vaccine into distribution to so many. But there are so many people who have still yet to be vaccinated. And this is the key. This is absolutely the key. We're just limited by the state law that we cannot require a vaccine. It would be the best thing if we could.
The next question is, what will U of A's COVID testing policy be like there this year? And will you do surveillance testing?
Yeah, we're still working through all of this. We've got great collaboration between our partners at NAU and ASU. We're all coming together to to try to have the same rules for all of our campuses. And we're in discussion with ABOR and the governor's office and the state legislature around how to move forward with that. So I think that I think we're going to see a high rate of compliance with all of what we're asking. I don't know if we have the numbers for how many vaccine downloads have been made from students, but my sense is that it's, probably over 50%, but we've got to get to that 85, 90%. And then with mask, I think, my expectation is everybody just mask up, at least when you're indoors. And I think we're going to see high compliance. We're obviously going to follow the numbers. And Rich may want to speak to where the numbers are now, but it's not going in the right direction. This Delta variant has been a game changer. We were concerned about this, and there are other mutations that are coming after Delta. So the best way to counteract this is to get people vaccinated. I think we should all be proud of what a great job ICS team did in conjunction with Pima County and the state. We delivered almost 250,000 vaccines to the community. Still not enough. Still not enough. Now you can go get the vaccine at many other locations now. So we don't anticipate we need to reestablish the pod on the mall. But as I said in my opening remarks, you can go to Campus Health and get the vaccine if you're a member of the university community. And I am pleading with you. I am pleading with you. Please, if you're not vaccinated, get vaccinated.
Yeah, and Bobby, testing has been set up for antigen testing available every day up at the Student Union. So we're prepared for that. About 43% of students have already downloaded their vaccination results to us. So we have an idea. As you said, we need more so we'll get a better idea, situational awareness of how many are actually vaccinated. And we will be strongly urging that all students, faculty, staff are vaccinated.
I'd just like to mention also that our testing is going to be available this weekend as we have move-in for our dorm students. Yeah. And that vaccines will also be available. And I think they're going to stand up a couple of mobile units to be able to provide those as we see a large number of students coming onto campus over the next week or so. So those plans will be outlined in the coming days and will be available on our COVID-19 website.
So Holly, you asked, I think that embedded in that second question was, will we do surveillance testing? The answer to that is yes. We're gonna go back and do what we know worked last year, was test as many people as possible, trace them if we get a positive test, and then of course isolate them, because we've got to be able to mitigate the spread of the virus. Moreover, we're going to continue to rely on wastewater testing to direct more intense testing. But yes, I want to see everybody as part of our university community tested at least once a week. Obviously, that is going to be voluntary at this point. I can't mandate it at this point. Certainly any question or any treatment of people based on vaccination status is prohibited. But I would like to see us have voluntary, altruistic behavior of get tested at least once a week, even if you're vaccinated. Because I'm telling you, I know personally of cases that were fully vaccinated, followed all the rules, and still showed up positive. So we're going to do extensive testing.
Bobby, you alluded earlier to the some of the other data that I think is worthwhile bringing up here. On a daily basis, as we did last year, we're tracking surrogates of transmissibility in the community. How many hospital beds there are available, how many COVID beds are occupied, how many ventilators, and so on. And the trend we've seen on a daily basis is more beds are being filled by COVID patients, more ventilators are being used for these type of patients. And in fact, I think the last number was the day before yesterday or yesterday that I saw, I think we only had 6 or 7 ICU beds left in the community. And that's a trend we're seeing around the country now. For instance, in Texas, where you were, Bobby, in Houston, they're out of ICU beds now, and ventilators are hard to find. So we're going back to the same challenge we had last year when we were still learning about this, yet there's much we can do to prevent that from happening. But the exhaustion of resources is going to be a challenge for all of us, especially as we go into the flu season now. And we expect the flu season will be a little better because people are masking up, but still there'll be an added disease burden, an economic burden. And we have snowbirds coming into the area, as they always do at this time, which tend to be elderly, and they have more chronic disease as well. So if we don't aggressively, as you said, address this, we will have some very big challenges as it relates to having adequate resources in the community to care for very sick people.
We have a couple more questions from Catherine. She wants to know, is there going to be a COVID isolation dorm just like there was last year?
Yes.
Yes.
Yes, right now, currently we have 150 beds available in one of our dorms set aside for this. And then we are also working with our partners in the community to make sure that if in the event that we do have a need for additional beds, we have those within the local community.
And we will, just to be clear about it, Holly, our isolation dorms, certainly at the first part of the term last year, had a lot of students in. We are going to see cases, and we will need to isolate them, and we will have the beds available for those isolation.
Right. And the ability to surge, as Holly said, with our community partners. So we can accommodate, I hope we don't have to, but several hundred if we need to put that many into isolation or quarantine.
Final question from Catherine is, will the school fully reopen with classes and activities in full capacity?
Yes, those are the plans right now, but obviously, as we have said all along, that's our goal for right now, but we will watch the numbers and we will respond accordingly.
Our next question comes from Christina Duran from Tucson Local Media. Go ahead, Christina.
I have 2 questions. So the first is due to this rise in cases, I know you've said at the moment you can't because of state law, but are there any plans on challenging state law at any point in case this gets, way out of hand?
Yeah, I don't think that we as the university plan to challenge the state law. I think there are others who are going to do that. I know some of the K through 12 school districts have instituted mask mandates, and I think we just wait to see how that plays out. Obviously, the under 12-year-old population is at high risk, and that's going to be a very important mitigating factor. But I think that there's already been some discussion about, is that, quote, legal for those school districts to be able to do that. So I think we're going to see this play out very quickly in a lot of places.
Thank you. Go ahead. Sorry.
I was just going to add to President D. We are in continued discussions with the state, the county, aligning all of us, the other university campuses. We've come up with suggestions to them as far as looking at certain indices of transmission that would allow us greater latitude. And that would be up to the governor, obviously, in the legislature. But, I just want you to know the president is working, really tirelessly at negotiating, giving us a little more latitude to be able to incorporate a lot of the public health things we think are necessary.
Thank you. And my second question is Dr. Joe Gerald's recent forecast. He noted that the outbreak could look at least like summer of 2020, but it has the possibility of looking like the winter of 2021 outbreak. Is that what you guys are expecting to see on campus as well?
Yeah, I think Dr. Gerald has been He's obviously an expert in this area. And, we were talking in the spring as we moved toward commencement that things looked pretty good and the Delta variant was under control. The fact is things have changed, and they've changed very, very rapidly. And the Delta variant is something that we've got to deal with. The good news is that the vaccines are very effective against the Delta variant in terms of decreasing the time to convalescence, keeping people out of the hospital and keeping them alive. But it's still the best way to prevent spread and to prevent the ongoing mutation of this virus. There are going to be many more variants as long as we're unvaccinated. We don't hit almost uniform vaccination. These variants are going to continue to crop up. There are others that are coming. We know that. The good news, at least in the test tube, and I think from human data, is that at this point, these mRNA vaccines, whether it be Pfizer or Moderna, is pretty effective against all of the variants that we know about so far.
All right. Our next question comes from Bud Foster. I think he's got a follow-up for you.
Yes, I do. Thank you very much. I would like to follow up on the question of whether or not you would challenge the state law. There's some serious question as to whether or not these laws are even valid. And there's some thought that they don't even take effect until September 29th, which would give you a couple of months head start on getting, the vaccines required, masking required, and those kinds of things. I'm sure that conversation came up. I'm sure you talked about that. What was that conversation, and why did you decide not to go that route rather than waiting for other school districts to challenge the law?
Yeah, I thought that the law was in effect now. I'd have to get some help on that. I'm not certain about what the September 29th date that you're referencing. Can you clarify that?
Yes, September 29th is when those laws would take effect. And because it's 90 days after the state legislature adjourns. So those laws haven't even taken effect yet. So that would give you a couple of months head start. And there's some question as to whether or not those laws are even valid because of the way that they were passed through the legislature. So that discussion was not held, or that discussion was held and decided that that was not the direction you wanted to go?
Go ahead, Rich. I'm not aware of any discussions about the September 29th date.
Yeah, I understand the legislative intent there, but of the law, but we still had an executive order in place that then became a law. So the governor had mandated, what we can and can't do, which then became law. So there's still a challenge there, Bud. As far as the legality of coming in, that's something we discussed with OGC, obviously, to ascertain that. But it's, many states, many universities are looking at this and challenging it. There's other states besides us where laws have been passed that the people are dealing with. But as the president said, it is a law or an executive order prior to the law, which mandates what we can and can't do. And we're working tirelessly to try and maximize our ability to keep the university safe and open it as much as possible.
My bad, I didn't unmute. Our next question is a follow-up from Craig Smith. Go ahead, Craig.
Gentlemen, when these restrictions came down, was there any active consideration of going much more heavily virtual remote again? And also on the issue of the isolation dorms, do you have the legal means to compel someone to go to those?
Yeah, so we discussed all options, Craig. We continue to discuss all options, but we're convinced that just like we did last year, even in the absence of a vaccine, we were able to get through the school year with very few people getting seriously ill. Now that we have the vaccine as part of our armamentarium, we think that we can go forward in this fully in-person environment. Obviously, we're going to have to watch and see how that works out. We think that we can convince enough people to get vaccinated and to keep their faces covered and to wash their hands and stay away from people in indoor settings. So we discussed all possibilities. What was the second question you had, Craig?
The second question was, do you have the ability to compel someone into isolation? But going back to the answer you just gave us, in that environment, you were able to compel testing, and now that's taken away from you.
Yes. But I think we do still have the latitude. Obviously, we can do wastewater testing and go in, because there are some nuances about if we have outbreaks, then we can do more vigorous testing. To go back to the earlier point about surveillance testing, I think that's always, that's what we did last year. As I remember, Rich, we could require that of our dorm students, and we worked out and strongly encouraged and got a lot of cooperation from local high rises to be able to do that, as well as our sorority and fraternity houses. I think we've got to do the exact same thing. This is exactly where we were last year with these restrictions that we have, but we do have the vaccine. And I'll come back to over and over and over. Our best hope is to get as many people vaccinated as possible.
And on the other issue of the isolation dorms and such, do you have the ability to compel someone to go to an isolation dorm if they come up positive?
Yes, if they live in our dorms, we can. We can say, you can't be in our dorms. You've got to move to an isolation dorm. Now, obviously, off campus, we don't have the ability to require somebody to do it. But again, this gets back to this, what's good public health practice, and, knowingly going out and spreading the virus. I have faith in people that they will look out for everyone else around them.
Craig, just to add to what Bobby said, which is absolutely correct, but in the community, there is public health law that provides guidance that when somebody, we hope, as Bobby said, people will voluntarily go into isolation, quarantine, depending on if they're infected or just at risk, so that we stop the spread of infection. But it is not unprecedented that the law can be used to force people to do that. Now, that's not the university. I'm talking about the community at large. When cases are picked up, public health law does allow you to be able to sequester somebody to protect the community.
And one more quick thing, Craig, just to follow up on that, our dorm students do have the option of also isolating off campus. They don't necessarily have to go to our dorms. They can. We've had students go to hotels. We've had students go home to their parents. We've had students rent Airbnbs. So they have multiple options if they do not want to come to the isolation dorm. They just have to work out that plan with our campus health providers and with our team here on campus. Our next question comes from Rocio Hernandez from KJAS. Go ahead, Rocio.
Hey, good morning. I just had a couple of questions. First, is there any contingency plan if these cases continue to rise? Would you ever go back to doing the hybrid classes or like holding classes at half capacity? And what threshold would cases have to meet for you to take a different approach other than the full in-person classes? Then I also wanted to know if we'll see the return of the COVID data testing dashboard, and if we'll see the return of, the controlling of how many students can gather. Would the CART team be deployed again?
Yeah, there's a lot of questions there. The dashboard definitely we will have. I'm trying to remember. Let's go one by one. I think what you are asking, we plan to go fully in person. We will continue to watch on a weekly, absolutely a daily basis, and we'll make adjustments as we need to, depending on the number of cases that appear. I do anticipate we're going to have cases. There's no question about it. So we've got to follow that very carefully, which we're going to do. And if we need to make adjustments, we will. And then the CART teams, I think, were what you was your last part of your question. At this point, we've not re-implemented the CART teams. We're going to keep an eye on that and always use that as another possible measure for mitigating. I think as Provost Folks it continues to emphasize, as long as the community is going to allow people to go out and go to bars, I think you're going to see our students doing that. My only request is get vaccinated, and if you go around other people, cover your face. I obviously can't mandate either of those things, but it's just good public health practice. And I would implore people, please get vaccinated. Please keep your face covered, because we're in a very fluid situation. Things are changing rapidly, and we'll continue to monitor, and we'll change rapidly as we need to.
We have one more hand up. It comes from Paul Ingram from the Arizona Sentinel. Go ahead, Paul.
Hi, thanks for taking the question. So one, will teachers and professors be allowed to move their classes online if the infection rate gets significant on U of A campus, or are those going to still be in classes?
Yeah, I think there's going to be a look at every single class. I was talking to President Crow, which we've been talking a lot, as you can imagine. I think he told me there are like 7,500 different classes that the ASU is given. And I think he's anticipating 19,000 students on their campus in Tempe. So I think that's why it's really good for us to be sharing what each of us are going to do and how we're going to combat this. But I think there's got to be flexibility. Just like professors, they're in control of their classroom, but obviously there are policies that can help the professors in their classrooms. But I would say, as I reemphasized earlier, I expect everyone who goes into our classrooms to have their face covered. I expect them to get vaccinated. So those are my expectations, and I'm one person, but I think that we're all uniform in understanding what the best public health practices are. We're struggling with the balance, and Rich says this much more eloquently than I do, about personal freedom and choice. But I just want to emphasize that those choices, think about them carefully, because they not only affect you, but they affect everyone around you, even people you don't know. So I think this, we're obviously in a very, very difficult situation. I do believe for the best quality education, it's in the classroom setting. It is good for people to be around other people because the mental health stress on everyone has been tremendous. And I would say, there are mechanisms for us if you decide that you just don't want to be part of going in person. There are mechanisms through the Disability Center at the U of A for professors and staff. And there are obviously mechanisms for students who can go to online learning. Not the ideal setting. And I'm convinced that it's better for us to give it our best effort to open the university fully in person. I thought that, at commencement, we would be in a different place. We're not. We just are not. So it's going to require, intense work by all of us. But we've got to continue to have the flexibility to have all options on the table. And we still have 2 weeks. There's a lot that can change in 2 weeks. So, we'll be communicating frequently. I'm assuming, Holly, this is the first of a weekly return to our briefings. And so, we'll have a lot more to say and answer questions on Monday. But over the next week, there's going to be a lot of behind the scenes discussions. There are a lot that can change. My hope is that, we can just convince everybody as part of our community to get vaccinated and keep their face covered. We got to do that for our whole community outside and work with Pima County, the state health department, our local officials. But there's going to be a lot of things that change even in the next 2 weeks and the first couple of weeks of the new semester.
One follow-up question. One follow-up question is, mentioned that the U of A would use certain indices that would push for latitude. I mean, is there a specific, what would that indice look like? I mean, what would be a point where you'd say we need to do something different?
Yeah, that's a really good question. And we're trying to work with, because remember, and I can't keep all this straight, but I think I've got the gist of the law. It allows us some flexibility once we, quote, have an outbreak. And we're working vigorously to define what an outbreak means. Now, most of that is directed to our residential dorms. And so, these are the kind of things that we'll report back to you. And we are vigorously working on behind the scenes to get more clarification about what the rules of engagement are that we can do.
That is our last question, President Robbins. Do you have any final comments?
I'd let Dr. Carmona, say what he needs to say, and then I'll close this out.
Thank you, Bobby. I guess I would just like to emphasize what we said all along. Please consider getting vaccinated. Remember, this is not only about you protecting yourself, it is also about you protecting your family and your community. Because if you're not vaccinated, you can be transmitting disease. And we know with this virus, you may be contacting anything from 6 to 10 other people that are going to get this, and then it just multiplies after that. So if you want to bring this to a halt, we all have to come together and get vaccinated and practice the good public health practices we've spoken about all year. Nothing has changed. The only way we're going to get out of this sooner is by doing that. If you're relying on waiting for herd immunity, it takes a long time and it will be quite costly. We'll lose lives, our resources will be depleted, and there'll be great suffering in our community. So to avert that, please get vaccinated. Bobby?
Yeah, I would agree with all you said, Rich. Even if you do get vaccinated, I think, and we're working out the details of how we would do this. I still think even for vaccinated people, I've heard, well, I got vaccinated, I don't have to wear a mask. I got vaccinated, I don't have to be tested. Delta variant has changed. It's changed it. So even if you are vaccinated, which I hope you all do, because it decreases the ability of the virus to mutate. But I would strongly encourage, and we're trying to figure out how we implement a testing strategy. And I would say, even if you're vaccinated, you need to get tested frequently. probably at least once a week. We're working all those details out. Obviously, I cannot mandate that right now, but I again expect everybody get vaccinated, keep your face covered, and frequently test. And we'll have more to say about that as we finalize how we would roll that out. But in the meantime, we said this every time last time, and it is even more important today. Get your vaccination, vaccinate up, mask up, and bear down.